There are many minimally invasive procedures that I use as a neurosurgeon. One of the most fascinating and most updated procedures is the CyberKnife. Previously, to treat brain tumors and to treat painful conditions of the face involving a nerve called trigeminal neuralgia, this required open surgical procedures. We now have access to a device called the CyberKnife, which enables us to do outpatient surgery, quote, surgery, really not surgery because there's no cutting, no anesthesia, and no recovery time. It's an outpatient procedure that is used to successfully treat a variety of tumors, blood vessel abnormalities, and painful nerve disorders. I've used the Brain Suite extensively. The Brain Suite involves an intraoperative CAT scan. A CAT scan is a three-dimensional way to image the spine or the brain. Usually and traditionally it's been used prior to surgery or after surgery. Having a CAT scan right in the operating room enables me to do CAT scans and image the spine or the brain during surgical procedures that I'm working on, so I can see if I've done exactly what I need to do, how far along I am, and what kind of results I've accomplished. It's very hard sometimes to prepare patients for neurosurgery. Patients who come to neurosurgeons have some pretty frightening diagnoses. They could be diagnosed with brain disorders, such as brain tumors. They can have painful conditions, such as spinal disorders, herniated discs, spinal stenosis, all of which can result in incapacitating pain. So the first thing you have to do is reassure the patient that they're not alone. This is a common thing that I deal with. This is the kind of thing that patients come to me routinely for. Once they understand that these are procedures that are routinely done, I think they're a lot more comfortable, and a lot of the education that I do in terms of telling a patient what to expect, what the procedure is going to involve, and what the recovery is like, helps to allay their fears. And I can honestly say there are technologies and procedures that we have here that still are not available at some of the university hospitals. Riverview Medical Center has made it easy for me to integrate technology and a variety of new procedures into my practice. They were one of the first hospitals to bring on board neuronavigation, which involves basically a GPS system for helping to minimally invasively localize lesions in the brain. They invested in the CyberKnife, which is a way of, again, non-invasively treating tumors and other lesions of the brain and spine. And most recently, they've actually brought on board the intraoperative CAT scanner, which again has helped me to do procedures more quickly, more effectively, and more successfully. So really, they're a very forward-thinking hospital with a lot of investment in things that make it overall safer and more precise for patients to have surgical procedures performed here.